Hi, I'm Dr. Priyanka, gynecologist and women's health expert. October is the Breast Cancer Awareness Month. Throughout October, we remind women to understand their risk of breast cancer and go for the different methods and screening tools to prevent or to detect breast cancer at an earlier stage. Breast cancer is a potentially preventable disease, and now it's one of the commonest cancer in women. That is the reason why it is so important that you identify your risk of breast cancer. So, if you're getting older, especially after the age of 35 or 40, if you're obese, you're gaining weight, if you have a sedentary lifestyle, if you are on some kind of hormone replacement therapy, or there is a family history of breast cancer, smoking, drinking alcohol, you have never had babies. These could be certain identifiable risk factors in which you need to start your screening mammogram and test a little earlier. Otherwise, the age of 20 is a good age to start the breast self-exam. When you start at an earlier age, the breast self-exam, say for the age of 20, you learn to identify how your breast looks and feels, and if there is a problem, you can identify that earlier. Breast self-exam is usually done on a fixed day or a date which is after your period is over. If you don't get your periods, you could just assign any day of the first day of the month or the last day of the month for the breast self-exam. Mammograms are done from the age of 40, and that's the time when you can even combine it with your other regular health check. After the age of 40, do a mammogram every year or every other year depending on the policy of the healthcare system where you are. After 50, it's a good idea to do a mammogram every year up to the age of even 75 and 80, because sometimes certain kind of cancers are detected later in life. At the age of 30, maybe you could meet your gynecologist or your physician, your family doctor, and discuss your risk of breast cancer. Because if there is an increased risk, you can start the mammograms even at an earlier age. There is a lot of concern and worry about how you do the breast self-exam, what about the mammogram, the risk of radiation, and we will be discussing all of that very soon. So remember, it's October, it's Pink October. Go for your mammogram and go for a conversation with your doctor about your risk for breast cancer. Take care.